All right. Crazy, crazy, bizarro, upside down world that we live in Canada. We have this piece from the Globe and Mail where now former Chief Medical Officer of Health of Canada, Theresa Tam, and Provincial Medical Officer of Health, Bonnie Henry, are among Order of Canada recipients, proving that only the most aggressive pandemic profiteers are the ones that get continually rewarded. The article starts off doctors, which I don't think Theresa Tam has ever seen an actual patient in her life. And I would argue the same for Bonnie Henry. But nonetheless, here we are. Doctors Theresa Tam and Bonnie Henry, leaders at the national and provincial level in Canada's efforts to deal with the COVID-19 pandemic, have both been appointed to the Order of Canada. Dr. Tam completed her tenure. Her contract just ran up this last month. Well, sorry, we're still in June, so this month. She completed her tenure as Canada's Chief Public Health Officer. Dr. Henry is still the British Columbia Provincial Health Officer. And they've been appointed this order, one of the country's highest honors. My gosh, I can't even believe that I'm saying this. But if you scroll down a little bit, it says that Tam is receiving this order because of her tenure between 2017 and 2025, characterized, this is a quote, was characterized by her commitment to health equity and highlighted by her leadership role in the country's response to the COVID-19 pandemic. I mean, nowhere in any of these reports do you ever hear about the vast amount of fumbling and non-scientific backed measures that Tam was responsible for implementing. I mean, it all started peak kind of pandemic hysteria in January and February, when really Canadians weren't being told that there was this novel pneumonia-like infection happening in China, which our intelligence agencies actually alerted Tam's agency to back on December 30th, 2019.
Yeah.
With the origins of all of this happening at the Wuhan Olympic Games in October of 2019. So there was a lot of yellow flags leading up to January and February 2020. And of course, by the time Canada implemented the state of emergency, which actually it wasn't Canada, they just told the provinces to all enact and implement it. But that wasn't until March of 2020. And so January and February, what was Tam doing? Well, she was shipping all of our PPE off to China, millions of tons of PPE, which if you know what PPE is, it's like flimsy and light and airy. And so if we're shipping, I think it was 19 tons of PPE to China in February of 2020, that is shiploads, containers, like containers upon containers full of PPE that Canada wasn't hanging on to, but we were too busy shipping off to Canada. And then, of course, we ended up not having enough PPE to supply our healthcare workers with, which wouldn't really have even maybe mattered because the emergency departments were completely desolate throughout March and April, and arguably for months thereafter, as surgeries were canceled, basic routine appointments canceled, and you were told basically stay home, shelter in place, save lives, and don't come to the hospital unless you can't breathe, at which point, you know, it's likely too late for you. And then we'll put you on a ventilator, which ended up just maiming more people than actually helped. So like, and that's just the beginnings of the pandemic. There's so much more that happened thereafter, and no one has spoken or been accountable or had transparent dialogue about any of that. Instead, we're giving these people the highest order of Canada. This is absolutely crazy.
Oh, I think we forgot one small detail in there, and there's just so many scandals that she oversaw. So it is difficult to remember them all. And if you guys can't hear me, I'm sorry, my earbuds just went crazy. So now I think my Jeep picked everything up. But again, this is a very live show. Let's never forget that she oversaw an agency that was created to deal specifically with pandemics, and then they didn't rotate the warehouses of PPE, and they had to throw out 2 warehouses of PPE when her agency only exists for pandemic readiness. And I feel like having the PPE on hand and rotating might involve readiness. And she didn't do that with two warehouses. And then they sent whatever they had left to China. Then when China was supposed to send it back, but their planes came back empty. And so I guess that's what gets you the Order of Canada, is not doing your job, but having the right politics.
Well, that's just it. And I did a report mid last week, where I'm highlighting some of the things that she leaves behind, which is a legacy of entitlement and evasion. I received some of her late 2019 emails, so her internal communications, where she was literally nickel and diming us, the taxpayer, for $20, $17, not even $20, a $17 parking fee for things that Parliament was prorogued, Parliament was shut down at the time. Parliament didn't resume
Mhm.
until December 5th, 2019. So she was charging Canadians for this parking fee for her to apparently walk up to Parliament Hill and go to some sort of event at the National Arts Centre on December the 1st. So what kind of official business was she partaking in when Parliament wasn't even sitting at that time? And Tam was making a crazy salary. She makes anywhere from 226,000 to 265 sorry $1,000 every single year, and she couldn't cover a $17 parking fee for something that likely was just her own personal affair. um, Not to mention that there has been absolutely no investigation into what happened at that Winnipeg lab, where you had those
Right.
two top level husband and wife scientists frog marched out of there in 2021. No transparency around what happened there, their ties to the Chinese Communist Party, the sharing of pathogens with the Wuhan Institute of Virology. I looked back on parliamentary records, and I don't think it was in this particular report, but there was the report where I mentioned the Public Health Agency appointed their fifth president in as many years, who this woman just looks so healthy, if you ask me. But official parliamentary documentation shows that there were concerns with that duo at the Winnipeg lab dating all the way back to 2013. And it took them until 2021 to finally get them out of that lab. So, this is the insanity that Theresa Tam oversaw from 2017 until now, ignored all of these yellow and red flags, and I would say failed grotesquely in her ability to adequately manage a response to a pandemic. And, there's a lot of things up for debate there, but they haven't been debated and there's been no transparency. And instead, Tam just gets to get the highest order of Canada. So thanks for that, government. Rant over. We have a Rumble rant here from Alberta Dawn, who gives $5. Thank you very much. Says Theresa Tam and Bonnie Henry, who pushed vaccines for pregnant women and children. Bonnie Henry owns a half interest in a winery that never shut down and did tours for tourists during COVID. Yes, these people, when I say pandemic profiteers, I am not lying. These people capitalized, they got rich, they lined their own pockets, they did things to move themselves forward at the expense of the vast majority of Canadians. Our small businesses were devastated. Mental health spiraled out of control. Children's health spiraled out of control. We isolated and segregated the vast 98% of the population who was healthy and robust, which then just caused a trifecta. I don't know if anyone remembers. I think it was 2021 or 2022. And I know because I had a baby at that time. And so the headlines were like, watch out, parents of young kids who were born or were really young when the forced isolation of the population happened throughout 2020 and 2021, because then it caused this trifecta of viruses resurging and was affecting children at a higher rate than it had previously because their immune systems had not been routinely and regularly exposed to just your random benign illnesses, colds, flus, etc., because they had been so socially isolated and locked in for so long that it was like a kind of a net negative for their immune systems. And so when this stuff started to happen, I'm like, geez, did nobody think that this would cause the devastation and fallout that it did and affect children especially in this way? I mean, public health is supposed to be about balancing all of that, and routinely what we saw from these health overlords is it was all COVID or nothing. And then they received the highest order of Canada for it. So, how are we going to prevent any of this from happening again? I guess we're not, because you get rewarded for this kind of horrible behavior and response. That is my little rant on Theresa Day. As you can see, I have a lot to say about that.